Hello and welcome back to MD to RN. If you're new here, the reason I created this channel was a personal vlog for myself, but I've decided to go ahead and share some of these videos for those who might be going through nursing school or becoming a nurse in hopes that they might find some of the information I provide helpful. This is my 11th video and it's been since December 19th, 2022. So it's been almost a year and a half since I made my last video. I left off in my last video by saying my final thoughts on attending Valencia College in Orlando, Florida nursing program, the associates. And then I also talked about getting hired in the NICU. I just started, before I even started getting working in the NICU. So right now, as I said already, I'm currently working in the NICU, and it's a level 2 NICU. To get the job in the NICU, what I did is, there's a couple things you can do. One of the things I did was I worked as a tech in a different area at this hospital I work at. And once you work in a different area, it's sometimes easier to transfer. I did leave that position, so I was not currently employed when I got this NICU position. But what I did to get it was I attended a career fair. I spoke with the managers in the department. And I also, when a recruiter reached out to me to negotiate or to see what interest I had in the positions, I kept on replying and responding to them. Sometimes they're busy and it's hard for them to get back to everyone. But if you respectfully reply to them and tell them, how interested you are and like, hey, I'm still here, asking them, hey, is it okay if I write you once each week to check on the status? I feel like that's really what helped me, get into the NICU. Also, another thing that helped is preparing interview questions ahead of time. Some of the questions I reviewed were just general questions that most interviewers ask. And they're things like, tell me about a time when, those type of questions. Also, research the hospital that you want to work at or the facility you want to work at ahead of time and know some key details about that facility and why you want to work there. Those things come across as I feel genuinely interested, and that helps you get the position, I feel like, at least. So I was a new grad in the NICU, and I started as a new grad in December of 2022. So right after I finished my associates in nursing. And then I had a preceptor for that time. It's supposed to be about 24 different sessions. But I'll get into that in just a little bit. So anyway, I've been working as a new grad in the NICU from December of 2022 until May of 2023. During that time, I took the NCLEX twice. And so that's the next thing I'd like to get into. The first NCLEX I took was on 3/7 of 2023. And it was the old generation of tests. So you had to get minimum of 75 correct and up to 145 was the maximum amount of questions. So that was a super difficult exam for me. The old version, the old generation of NCLEX. I got all 145 questions. And the way that the test works is it goes off of your knowledge and it gets progressively harder and sees what questions you can answer. Once it's satisfied you've reached a threshold of correct or incorrect answers, it either passes you on the test or fails you. And so I got to all 145, so I must not have been doing horrible because it would have cut me off before then. Anyway, within those 145 questions, I had 55 select all that apply questions. I'm reading off a little note here. And in the first 75 questions, I got 32 select all that apply. So I don't know if anybody's taken the old gen or remembers, but with the old generation tests, select all that applies. If you don't get like one of the check boxes right, or you click too many of the check boxes, the whole question's completely wrong. You get 0 points. So it was so challenging to have 32 in the first 75 questions. That means like just about half of my questions were select all that apply. And like most people, I am not strong with select all that apply at all. Anyway, long story short, I was devastated that I failed the first time. I felt really stupid. But I picked myself back up and I decided to right away schedule again. You have to wait, I forget how many days in between, but the next available quickest test I could take was on May 4th. And that day is special to me because I like Star Wars. So if you're a Star Wars fan, May the 4th be with you. Anyway, so the new test is the new generation of NCLEX, and it has a minimum of 85 questions. And I don't remember what the max is, but besides there being a different amount of minimum questions, the format was somewhat different. Like a lot of the questions were laid out the same, but for one example is select all that apply. It gave you partial credit for the answers you had right and wrong on that select all that apply. So at least you didn't lose all your points if one box was checked or not checked, or a couple. And there were some other things that got added, like they added, I forget what exactly they call it, but it's like a chart review, like you're pretending to look through a medical record and you're actually using a little bit of critical thinking to try to solve the questions, but I really actually enjoyed that a lot. I know it's a test and they're not really very fun, but I feel like those questions were more realistic and more fair. So I was really nervous when I took the test. While I was taking it, it shut off at 85 questions. And I thought to myself that there's no way I could have done bad enough to fail 85 this time at least. So I left the facility. I got my confirmation that my test was completed. And then a little bit later on that day, I did the Pearson VUE trick. I don't want to go into details on how this works. I don't advocate for it because sometimes people get charged for a whole new test and they didn't need to. And so I don't advocate to do the Pearson VUE trick. I'm just saying I did it. And both times I did it with the old version and the new version, it was correct. So the new version said I passed. And the next day, the Florida Board of Nursing website updated and gave me my license number. So since May 5th of 2023, I've officially been a registered nurse. It was so exciting to feel that I finally passed all the hard work. It's just studying for NCLEX is not really very fun. What I used was Archer Review because it was less expensive than UWorld. And I did do some of the UWorld free practice questions. They're very similar to Archer. And I've had friends who've done both. And some of them have passed with UWorld, some of them have passed with Archer. It really is a toss-up. And to me, they seem very similar format. I would go with the cheaper option, especially because I believe although the test is laid out like Archer and UWorld, it's like it helps you so you feel more comfortable with the layout. The questions were not the same, not for me at least. There might have been like a handful that were like very similar to questions I had on either Archer or UWorld. But in general, these questions were like brand new questions I've never seen before. It was still very challenging. You just have to use what knowledge, I guess, that you gained during nursing school. Although I'm not really sure about how much I feel like I gained in nursing school. Anyway, that's a different story. So anyway, I used Archer. What else did I use? I used NCLEX Crusade International. You can go to their YouTube channel. They might have a website now, I'm not sure, but they offer many, many, many free videos. I like the way the guy delivers the information. I used to watch his videos kind of sped up, so a little bit faster. And he provides a good breakdown and some some tricks and tips on how to answer certain types of NCLEX questions. I also used Mark Klemick lectures. One other thing I did was hire an Archer tutor for, I think it was 3 sessions. And what she provided me was the confidence. She helps you go through your thinking on each question. It's like, why did you get this answer? How did you come to that? And she can help pinpoint some areas where you're going wrong. She's like, I think like some of the tips she gave were like, the first thing that comes to your mind is usually correct. Don't change your answer, things like that. I mean, we've heard those things, but to hear somebody help you go through your thinking actively and give you tips. I don't know. I found it very helpful. So it's not necessary, but I do feel like it was helpful. So after May 2023, I was off of orientation. It's considered orientation. And that's what I wanted to get into. I started to get into before. So I'm in a level 2 NICU, and the orientation is 24 shifts where I am, which is equivalent to about 8 weeks. Along with that, you have to attend graduate residency, which are classes that happen once a month for a year. And these classes are supposed to help you have a more well-rounded view of the organization, and like some of the things it can go over are like trying to think like different security and risk measures. I mean, that's just one topic, but each month there's a new topic. I personally, I'm going to be honest, I did not find these helpful in the least bit. You can interact with your peers, but other than that, I didn't find them helpful. That's another topic, another story, another video one day. I didn't find those helpful. So I had my 24 shifts. I passed my NCLEX in May. Then I was off of orientation. I'm going to be honest. The reason I haven't made a video in like a year and a half is because I was really struggling. Like nursing school was the biggest struggle probably. But then after that, I went right into working. I didn't take any time off, no breaks, no fun vacations, nothing. And I started working in the NICU. And although I had worked in other areas at the hospital, such as the bariatric unit, trauma, med-surg unit, I'd worked as a patient sitter. That's sitting with patients who might be at risk of hurting themselves, or that just needs somebody, like a child that needs somebody to watch to make sure they don't like pull out their trach tube or something like that. I did that. And anyway, so long story short, I started in the NICU right away, and I really felt extremely burned out. I was still taking classes at UCF for my bachelor's portion of my degree. And I wanted to quit. I cried like daily. I thought maybe this isn't for me. I made a huge mistake. And honestly, these are real feelings. Like it was not like, I don't know how it's coming across in the video, but these weren't light feelings. These were extremely heavy. When you become a new nurse, especially if you haven't been a nurse before, and this is your first unit, you feel you have so much to learn. You don't know everything at the beginning or even in the middle, and there's always things to learn throughout the time that you're a nurse. But especially at the beginning, there is so much to learn. And it's not like there's a huge margin for error because you are dealing with somebody's life. So it's very stressful. You just got this new license. You don't want to lose it. You don't want to hurt somebody. You want to do things right. You keep messing up. Like it's very humbling. I feel like I'm a fairly humble person, but this really just like kicks your butt. I mean, I don't know how else to describe it. It's very demeaning, and I don't know if demeaning is the right word, but it's challenging, and it takes I feel like a strong person to actually make it through this relatively unscathed. And like I said, I wanted to quit many times, but what I told myself was keep going, because there's a lot of times when I felt like quitting, and I did quit sometimes at different things that I've done before. And then later on, I may have slightly regretted some of those decisions and thought, well, what if I would have just stuck with it? So I'm like, this I've worked hard for. Let's stick with it. Let's see in a year how I feel. So time went on. Our unit is extremely busy. It's one of the largest units that has levels 2 through 4 under one roof in the United States. So we're not a small unit. We're a huge unit. And oftentimes our ratio is 1 nurse to 3 or 4 babies. Before I started, I heard that some people had taken 5 babies. I do not feel comfortable with that. I will never do that. I don't think it's right. I don't think it's safe. So anyway, I've taken 4 and I don't feel comfortable with that either, but sometimes it's just the way it goes. It is doable. It's just when you have 4, it almost seems as if you have to treat each patient as if they're just like an object or a number, and you have to keep going. You can't stop. You can't chat too much, or you'll be behind, and then the whole night will be kind of behind. So anyway, I don't really want to delve too deep into that. After a year, I started to feel more confident. So my year mark of actually working in the NICU, so as I said before, I was a graduate nurse in training orientation from December 2022 to May. And from May 2023, I've been a registered nurse. So as a registered nurse, it's been almost a year, but working in the NICU, training to be a nurse, basically doing everything a nurse does for the most part. I've been there for a year and a half. And it's taken me till about a couple months ago, which will be at the year-ish mark, a little after a year mark, where I felt better about going in. I used to get severe pre-shift anxiety. I'm not going to lie, I would call in a lot at the beginning because I was so anxious. It was just overwhelming to me. So anyway, I feel much better now. I really love working with the babies. That's my favorite part of my job. The sweet little innocent babies are just the best. Honestly, I feel like for at least my personality, the NICU is the exact right spot I should have ended up in working as a bedside nurse, at least to start off with, and I feel like forever. But yeah, definitely the babies. They're small, so they're easier to move. They're sweet and innocent. And I do like the way the NICU works because as they're babies, you have to feed them continuously. So every 3 hours, 3 to 4 hours, we'll go in and we'll feed each baby. So you're never just sitting. You're never just sitting. There's not been one time where I've been on shift in the year and a half that I've worked there where I felt like, oh my God, this is so boring. Like that's never happened. Like you're always doing something. You might not find the work as meaningful, like changing a diaper or feeding a baby. Maybe that might be possible, but actually being busy or not busy, no. I mean, you're always going to be busy, especially if there's 4. So there's so many things I still don't know. There's things throughout even after this year, next year, and the years go on that I won't know. And that's how everybody is. And what you just have to do is keep asking questions, keep learning. One thing I want to stress, I've tried to be very careful about myself, is if you really don't know how to do something or don't know the answer or it doesn't make sense, like I'm not sure I should be doing this or that, please ask somebody. Like I would never want to hurt somebody, a baby or anything. So always ask somebody else who you feel comfortable that has the right answer. Usually that's a charge nurse, or some kind of resource that you trust to help guide you through that. Don't just like think, oh, I'm going to use my critical thinking and solve this, which is good to use critical thinking. But if you really, truly just don't know and you're kind of iffy in your critical thinking, you really should ask somebody. So another thing, I've been working night shift. I've had plenty of opportunities to move to day shift. I, at the beginning, like begged for day shift. And they told me you have to be put on a list and wait. And the amount of time they told me they had to wait, I don't remember what it was, but it was many months. And anyway, they ended up telling me early that, there's a day shift spot available, and I declined it. Night shift has kicked my butt, but I really love all the people on night shift. I'm not saying that night shift people are inherently different than day shift people because we're all just people. But I do feel like there's a certain characteristic of person who tends to work night shifts. And I feel like I really resonate with those kind of people. I also prefer night shift. I don't feel like you necessarily do less. I just feel like there's less eyes on you. You do have less resources generally at night. So it does make things a little more difficult. Like in the daytime, there's so many doctors are there, social workers are there, but that also makes it more stressful too. So there's trade-offs. Night shift has really done a number on my probably physical health and mental health as well. Once you work a night shift, or at least personally for me, the next day my body hurts. I feel like really tired all day, like zombie tired. Um, anyway, I can get into another video on some things I've done to kind of help me. I don't know how sustainable night shift is going to be for me forever, but I just know I really don't want to go to day shift. So yeah, for now, anyway, night shift is difficult. That's the end of my journal on that part of it. So as as I'm a nurse right now, I'm going to be graduating my BSN from UCF, University of Central Florida, in May of this year. So right now it's March 20 something. And so I really have like a month and a half to go until I graduate. So I'm really excited about that. I cannot stress how much I can't wait for no more homework. It's just one less thing. You get home and there's like papers to write, discussion board posts, research to do, and it's just another drag if you're just really just trying to make it through. So that'll finish in May, and I don't know if some of you have watched this video, some of you haven't, but I started the BSN concurrently. So at the same time, I was in my Associates of Nursing at Valencia. Back in summer of 2022. So summer and winter, I did classes. I took spring of 2023 off to study for NCLEX. I really wanted to pass. Then went right back to it, summer, fall, and now this is spring again of 2024 that I will graduate from the concurrent program. I'm super excited. What's next for me? What am I going to do next? Well, I've applied to the for a Master's of Nursing program at UCF called Healthcare Simulation. I don't know if I get accepted if I will actually go. I'm not sure. I really feel burned out from school. I have prior degrees. This is my second career. So I have a Master's of Management Information Systems and a Bachelor's in Nursing, as well as my associates. A Bachelor's in French, along with my associates in nursing. So, I mean, I have other degrees and I just feel kind of tired. But I might go for that. My goal is to somehow merge my other master's, which is in Management Information Systems, with nursing. So maybe I can do something with nursing IT. But I also really love teaching. So I don't know if there's some way to put those three things together. I'm still looking. I have looked at remote nursing roles. Those are very competitive right now. Like they're almost unreachable. I mean, of course, lots of people get hired into those roles, but it's such a game that you have to really like tailor your resume. You have to be the first to apply. Like it's like a game that I'm too tired to play at the moment. But I really would, I think, like to work at least partially remote again, like I had been doing in the past with my past jobs. So that is something I've been trying to do. But anyway, so I just wanted to make this update video. Those of you who know me know I take these videos in one cut. I don't make any edits. And a lot of it is because I just don't have time. And these are really just my journals. These aren't some things that's supposed to be super spectacular for anybody else. One day I might go through and watch my videos again and think, oh yeah, I remember that time in my life. That was challenging, but I overcame it. So yeah, the whole reason I even started wanting to go to nursing school spurred off of something very extremely traumatic that happened in my life that still affects me to this day. But I was at such a low point right before I went to school, that nursing school really gave me something to hold on to. It was hard going through that thing that I just mentioned while starting nursing school, especially at Valencia with all the trouble I had there. I feel like it was just a beating that it was a little much for me personally. I don't know if some people who maybe not had so much struggle before they started school might be a little less unscathed as I was, but for me, it was like I was just crawling like to the end of the finish line for nursing school. So you can do it if you're in a similar situation or you have been. You really have to decide it's something you want to do and finish. For me, if you even took away the empathetic aspect of nursing, I really wanted something that was more stable income wise and that would be also more stable, like almost always there. I don't think there ever going to be a time when they're not going to hire nurses. Like nurses are always in demand. And so I feel like that also adds to the stability. Plus, I do get to help people. You get to use critical thinking. Um, I love 312s. 410s would be okay too, but not 5/8s. I could not go to back to working 5 days a week, 8 hours a day. That to me sounds like torture. I really enjoy my days off. Actually, I don't even know how other people in society function on the 5/8s anymore. That's all I used to know in the past. So I've been there. I've done that like most of my life, actually. But yeah, the 312s are just, they're great. I love them a lot. So that's really the end of this video. If anybody wants me to talk more about some things in the NICU that I think, like supplies that are helpful, or some tips on like things to study ahead of time so that somebody can, better grasp the concept of working in a NICU. Um, NICU stands for Neonatal Intensive Care Unit, for those who didn't know, but really it's just like an ICU for babies. And ICU is it's a challenging field to start out in. I do see why people say they suggest starting in med surge. I understand it. That was not something that was ever going to work for me. I don't think I could ever even make it through med surge enough to then transfer to, I think I would quit before that happened because I just am not interested in med surge. So kudos to those who do work in that area and find it interesting. It's just a little bit too broad of a topic for me in my head. And anyway, that's without saying. The ICU is very challenging. There's been lots of rewarding things. Some people have mentioned that you lose a lot of skills in the NICU, and I guess they should be a little more specific on what they mean by lose skills. Yeah, you're not dealing with adults, you're dealing with babies. It's a very specific subset of the population. There's special heart rate, there's special growth factors, like developmental factors that go into newborns and premature babies. And you lose some of the adult skills that you might have. But there's a whole new set of skills with the babies that you'll learn. And you're still doing IVs, you're still taking blood, you're still dealing with parents and other adults. So I don't feel that you're really losing. It depends on which skills you want. So that's why I said they should be more specific when they say you're losing skills. I've also heard some people say that it gets boring after a while. And that really, I think it depends on your personality and what you want. I'm in a level 2, which is considered growers and feeders. So they're doing fairly well, although they could go south quickly too. But they're almost kind of working towards wanting to go home soon. Level 3 would be like babies who have bubble CPAP machines on. And then level 4 would be intubated babies and babies that have, higher acuity. Those teams generally take, level 4 generally takes 1 to 2. Level 3, the bubble CPAP babies generally take 2, maybe 3 at the most. And my level 2 takes 3, maybe 4, possibly 5 at times. So there is a difference between all those levels, and a lot of hospitals just make all their nurses know all the levels. But the hospital I'm at, I feel very happy and lucky that they let us choose if you want to work in level 2, or they kind of combine levels 3 and 4, I think. I don't think they separate them. So anyway, you can choose at my hospital that I work at, and I much prefer the level 2 babies, not just because they're a little more stable, but because there is more of them. So although with a higher acuity baby in like a level 4, you might, there's less babies. You do have things you're monitoring like all the time. It's just, you don't get to hold the babies hardly at all, or really not supposed to at all. And a lot of times you don't give baths to babies. It's a little more critical dealing with the parents, although I feel like I could handle that aspect of it. I really like to hold the babies. They really have little personalities that when you're in level 4, a lot of times they're sedated. It depends. Maybe you like to use your critical thinking a lot, and that might be where you might consider level 3 or 4, because I do feel in general like you use critical thinking more often. Not saying that you don't use it at all in level 2. That's just my opinion. So I'm so happy that I'm in level 2. That's the perfect area for me personally. So I think I was wrapping that up to saying I don't feel bored. You are, of course, changing diapers and feeding babies, and that's where people get the aspect of this is boring. But you're also doing so much more. You're checking to make sure the heart rate sounds correct, is it's not skipping beats, that if there's a murmur that you note it, that if their abdomen is too large or too small after you measure it, that you notify the doctor. If you notice that they start puking or emphysising more often, that you make sure you tell somebody, and so they can look into it. I feel like there's a lot of things that makes it not boring. So I very much enjoy my work. I enjoy the variety. I enjoy always being busy every 3 hours for sure. Between the every 3 hours, you're charting. It's just, there's a lot to chart. Like in the NICU, it's heavy on charting. So, I mean, that's another thing to note too. But yeah, this video has been longer than I expected it to be. I just wanted to say thank you for everybody. There's been so many people who've, since I stopped making video in December of 2022, there's been so many people who've written comments. I've seen them all. I'm not going to respond to those comments because I feel like a lot of them are old. But I do want to say I'm not going to mention anything else about Valencia because I don't go there anymore. Like a lot of people have asked questions like, can this program be done part-time? Is it only nights and weekends? When I was going there, it was not strictly. It was supposed to be because it's called a night and weekend program, but it really wasn't. And they said basically, too bad, we'll schedule you when we want to schedule you. So I felt like they kind of duped people. But I don't know if it's still that way. And I've been out of school since December of 2022. So things might have changed. Please reach out to the school. I don't know the answers to the questions about Valencia anymore. It's old to me. I don't go there anymore. As far as UCF online classes, if you have questions, I can answer those, hopefully. And as far as NICU things that are related, or questions about working overnights, or any topics for new videos that you are interested in. These are vlogs, but I'm going to look back at them one day. So like maybe there's something that I can help you out with, and then also, keep for myself one day that maybe like, oh yeah, I'm glad I talked about that. I forgot about that part or something like that. So anyway, there is somebody who also wrote me on Facebook, a young woman, I believe. I wanted to say thank you so much for writing me. I did see your comment. I'm sorry I did not respond to you, but I really appreciate you saying that I've been an inspiration to you. So the intent wasn't to inspire necessarily anybody. The intent was to make people who are having trouble or trying to decide, on nursing school, to help them, not feel alone, and to also make the journals for myself, of course. So anyway, thank you everybody for all your comments, and hopefully I'll make another video. I really don't know what topic I would do it on at this point, but I wanted to make this follow-up at least. So keep on keeping on, everyone.